reasons or the causes of stomach upset or discomfort or pain after eating. Normally, the reasons or the causes, some reasons may not be too serious, but some may be a medical condition. So we'll be looking at all the 20 in the next couple of minutes. But you see, the reason why we eat is not because we are hungry. It's not the first reason, not the primary reason. The primary reason is to get nutrients from the food we eat for repair of the body and maintenance, building our immune system. So it's important that we know the right food to eat. We cook from scratch, and it means from the very beginning we know the ingredients. We don't eat processed food or semi-processed food, and then the circumstances around the food. It means if you are walking, if you're in a hurry, you're chewing very quickly, you're drinking with your meal, drinking alcohol or whatever with your meal, or you are angry before food, or you're stressed before food. All these will contribute to good digestion of your food, to get in nutrients. Sometimes some people may overeat. Overeating can be a problem, so it's important to eat and be filled up about 80% full. It's very, very, very important. But at this point, what are the 20 reasons why we have discomfort or stomach ache or pain after eating? Number one, food poisoning. When we talk about food poisoning, it just means that the food you've eaten or the drink you've drank, there could be some pathogens or germ in that food or the drink that may cause problems to your stomach lining, and then can cause symptoms like vomiting, diarrhea, or nausea and high temperature. These food poisoning symptoms could come after a few days or weeks. Okay, but normally the person is right to the hospital and is given some sort of infusion to be released. So it's important to be very careful about what we take in, not to just get anything from outside. The next cause is acidic foods. Not that the acidic foods like maybe tomatoes or the lime or lemon is not good for us, but lemon itself even is not acidic. When it breaks down, it's alkaline in the stomach. But because the stomach wall may be inflamed, maybe you have gastritis, it could actually react. Your body may react to acidic food, because there are some people that may take tomatoes or maybe salad dressing and they're fine because the lining of the stomach is fine. So if you react to acidic food, you have to solve the problem with your stomach lining. It's very important. Sometimes some people may have what they call trapped wind. While they're eating, they're talking and talking, so air could get into their system and it could be trapped. Sometimes it could be the fact that they don't chew well and they are experiencing indigestion, producing more gas, and the gas is not coming out, and so it's trapped and it can cause stomach ache after eating. That is also another reason. Spicy foods. It doesn't mean that the spicy foods are not healthy, but maybe your stomach lining once again is not healthy and is reacting to spices are really healthy if you take them in moderation. But then if your stomach wall is not too less sensitive and it is working well, you shouldn't react to stomach that is spicy food at all. Indigestion. It means that the food you've eaten is not digesting well. That is common problem actually among so many people. Normally, how do you find out if you're experiencing indigestion? Now, when you eat a little bit, you feel full. And after eating, you are full for a long time. That will mean that you have a low stomach enzymes and low acid. When I talk about enzymes, it's a chemical your stomach produces to break down the food. You may have less acid to break down the protein and get things going in your gastric system. So normally it's advisable that about 30-40 minutes, take some warm water, add a little bit of ginger to it. That can increase the acid and enhance your digestion to prevent that. caffeine and alcohol. Eating and taking this caffeine and alcohol, let's say some sparkling wine, can cause indigestion. It means you have more gas and more mucus after eating. That can also cause stomach ache as well here. The next cause is also very, very clear, and that is overeating. When you eat too much, more than enough, you may have less acid and less enzymes. The chemical your stomach produces, it cannot act well on the food, and that can cause indigestion, and you can cause pain after eating. So we should be 80, maximum 90% full when we eat. The next cause here, they're more medical, and that is gastritis. What is gastritis? It's just the inflammation of the lining of the stomach, and that can normally cause stomach ache, and then it may make you feel nauseated. All right. The next medical condition that may be causing the stomach ache after eating is inflammatory bowel disease. Inflammatory bowel disease, we have two common types. That is ulcerative colitis, which means that inflammation of your large bowels or of your colon, that can cause stomach pain as well. And then we have Crohn's disease. It can affect from your mouth to your anus, anywhere, your stomach lining or your small intestines. That can also be an indicator that you may have this inflammatory bowel disease. Number 11 is a stomach ulcer. That can be also indicator if you have chronic pain normally after eating. Number 12 is what they call the irritable bowel syndrome, IBS. Here, no machine would detect that you have any problem with your gastric system, but your gastric system is not functioning. It's not digesting your food well. So that can also be an indicator that you have this problem if you have pain after eating. Gallstones can block your bile duct, the channel in your liver, and that can cause pain, severe pain on your right side, and that can radiate to your back, and that is also another reason why you may have stomach pain after eating. Heartburn normally is popularly known as acid reflux. That can be also a reason why after eating you have stomach ache. Now, overactive thyroid, that is hyperthyroidism, that can also cause stomach ache. Normally you may have not only the ache, but you may have diarrhea on top of it. Now, other causes here is a pancreatitis, the inflammation of your pancreas. Here, how do you realize you have this problem? You see that the upper abdomen, you may have pain there that may radiate, or the pain may spread to your upper back, and that can also be an indicator here. Now, another thing is chronic stress. When you're chronically stressed, you reduce your enzymes and the acid in your stomach, so you can digest well. That can also be another cause here. Being overweight. When you're overweight, you have less blood getting to your stomach normally. That can cause indigestion and can also cause stomach ache as well. Constipation. Chronic constipation can also lead to stomach ache after eating. The last one is a blood pressure medication can cause you to constipate, at the same time can cause stomach ache after eating. Well, beloveds, we've learned the 20 key reasons why we have discomfort or pain after eating. If you have any problem that has been going on with you, one call away and your life will never be the same. If you're calling outside the UK, it's +44 738 464 7300. If you're calling within the UK, it's 0738 464 7300. If you want to learn more about my videos, I have social programs. Go on my YouTube channel, put it in Dr. James Natural Link, Dr. James Natural Link, and subscribe and support the channel.